Hello, my name is Marek Karman and you are listening to podcast Kardio MD. Today I'm excited to talk with my two distinguished guests, Professor Maully J from Philadelphia and Dr. Vieru Illíková from the Children's Cardiac Center in Bratislava. In this episode, we will take a more personal approach, exploring their journey into medicine and pediatric electrophysiology and what led them to become leaders in their field. I'm eager to hear about the challenges they have faced, what motivates them, and how they balance their careers with personal life. Welcome, and I hope you enjoy this episode.
Generálny partner podcastu Kardio MD je spoločnosť TIMET. Hlavný partner je spoločnosť Medtronic.
I'm happy to having you here to talk about your career and especially maybe for me important topic, women empowerment in medicine and cardiology. So, welcome.
Thank you.
Thank you so much.
Can you share your journey to becoming a pediatric cardiologist, or specifically in the field electrophysiology? What influenced you, or who influenced you in this career way?
So for me, my path is a little bit different because I was not born in the US. I was born in India and I went to medical school in India, and I was exposed to a lot of complex patients when I was a medical student, because even as medical students, you have a lot of clinical responsibilities. And one of the most fascinating patient population I found were those with cyanotic congenital heart disease. And as a medical student, I was particularly fascinated by the physiology of tetralogy of Fallot, which is a cyanotic congenital heart disease lesion. And these kids were very blue. And I would notice that they had figured out for themselves that they would squat, and when they stood up, they would be a little more pink. So they would increase their systemic vascular resistance by squatting, and that would prevent the right to left shunt, and they would get more oxygenated blood. So just like simple observation of this physiology without any diagnostic tools was my first spark of pediatric cardiology. Like, how can this happen? They're blue, they sit down, and now they're pink. And so that led me to delve more into the field of pediatric cardiology. And then I realized there were so many different types of combinations of lesions. And I just found that physiology so fascinating that I wanted to master it. And there was no training available at that time in India. So I came to the United States specifically to become a pediatric cardiologist.
So for me, it's a different story. My mom was a pediatric cardiologist, and I was growing up with the very simple model of the heart, which was in our house all the time. And I visited her as a child many times in her outpatients. She was doing outpatient. She had very serious injuries, so she was doing partly. I visited her there many times. I saw how they are doing ECGs and things like that. Echo at that time didn't exist. And my father was engineer, and he wanted me to study something like that. So I was hesitating between that, but I still remember that model of the heart, and I just went to medicine. That was first. And the second, when I was studying medicine, I did pediatric. That was like natural decision. I didn't even think about adults. It was for me like natural that I will do children. I will treat children. And then I went to old cardiovascular institute where my mom had friend. It was our friend, colleague. It was Professor Seaman. He was well known in Slovakia. And I observed few surgeries, and I was really excited by that. But I remember the sentence of one of the big surgeons, adult cardiac surgeons, who told me, "You can observe cardiac surgeons, but you can't do cardiac surgery." Mm-hmm. So I remember this, but I was like, okay, I would be a cardiac surgeon. But then I I didn't want to be cardiac surgeon. I wanted to do cardiology, and I went to to ICU, to cardiac intensive care unit, and I worked there. But then if you ask about electrophysiology, it was just by accident, because I had quite difficult situation, and I wanted to change ICU for normal cardiology ward to have a little bit more time for my children. But our management at the time a little bit put me in the corner. So either to do electrophysiology or nothing. So I started to do electrophysiology, and it was very difficult for me because I had nobody to teach me at the beginning, and the time for my children was even less than before. But the electrophysiology was so interesting, and I met so many motivating people. Also my colleagues in Prague, in Leipzig, and also my adult colleagues here in Institute of Cardiovascular Diseases, that I was really excited by electrophysiology, and then I just didn't want anything else. So that's all.
And what was your milestone in the way to electrophysiology?
Right. So when I was doing my pediatric cardiology training, initially I didn't want to do pediatric electrophysiology because I didn't think I was smart enough to do it. It was like very detailed. It wasn't like an echocardiogram where you see all these images, or a cardiac catheterization where you see dye in the heart. It was this micro analysis of minute electrograms. But my boss at that time thought that I would be a good candidate. She herself is an electrophysiologist, and I was sort of her chosen one, and I didn't have the courage to displease her. So you can say that my path is a path of default. But then when I discovered electrophysiology, I totally fell in love with it, because it is one of these specialties where you have to have a hypothesis for an arrhythmia, right? So you have to have a hypothesis, and then you collect the right data to either prove or disprove your hypothesis. And if you prove your hypothesis, then you can manage the patient in the appropriate manner. You have the perfect treatment plan. So there isn't a lot of like guesswork or empirical medicine to it. It's a very exact science. And it's the only field in cardiology where you have interventional skills because you're doing catheter ablation. You have surgical skills because you're implanting devices. You take care of patients with arrhythmias in the ICU. So you have that acute ICU management time. You also see patients in the ambulatory setting, and you can have a lifelong relationship with patients in your clinics. But it gives you the ability to do intensive care work, interventional work, and surgical work. And I don't know of any other field in cardiology that gives you that opportunity. So I feel blessed that I went into the field, kind of not my choice, but I am so fortunate that I am put in this position, and I just love it.
So I think our paths were quite similar. That it wasn't the field which we choose, but it is the field that we really
were
fell
given
in love.
and we fell in love with it.
Yes, and it's very logical. And this is also, as I was doing before ICU, my skills from ICU helped me a lot in electrophysiology, and I need to do something also manually. And so when you put it all together, these logical things, that you do interventions, everything what Professor Shah said, then it's really fantastic. But I remember when I was in 2008, I went to Leipzig, where is a big educational center for electrophysiology. And there were like, it's for adults, and I had a friend who was doing pediatric electrophysiology there. And you had many of these, that time we didn't have so many EP labs here in Bratislava. And there were like, around me, 10 EP labs, and everywhere is like MRI, CT, ECG, X-ray. And I was sitting there and I was like, what did you do, Viera? You can't do this. It's not possible that you can manage this. So, but I just stayed. So I continued in this work. I know that there are many, many things I still don't know, but it's very nice.
My next question is also the next chapter. Working in medicine, especially in the leadership role, can be very challenging, and it's easy to forget about work-life balance. How do you manage it? How to balance such a demanding job with your personal time?
I think maybe I'm going to sound a little old school, but I think medicine is a calling. It's not a 9-to-5 job. And I think if you treat it as a 9-to-5 job, either you're going to get frustrated or it's not going to be as fulfilling. So I don't divide work, life. I think work is part of my life. Mm-hmm. That doesn't mean I only work. I have a lot of interests and I enjoy life, but I don't deliberately have this new age separation of work-life balance, because work is my life. But I want to make sure that I emphasize that that doesn't mean that I don't have a life. I have a vibrant life. But, that's what a physician has signed up for, is that you don't have what I call banker's hours. You're not just a physician from 9 to 5. You're a physician all your life.
Nice recipe for the nice career. And
yes, I agree with that. I think many, many years I just lived with my job. It was like my hobby. So we stayed after work. We had nothing like we have to go home or something like that. And so it was really hobby and the fulfilling life and everything. Maybe after years when I started to feel tired sometimes, that time I was like, I would somehow have to change, that I would need more time for relaxing. And so, but still, I also really can't divide it into work and my life, because
so when you love it, you don't expect the burnout syndrome also.
Yes, but sometimes it can happen sometimes. If it is really too much, then it can happen. But it's when it's not your hobby, then it can happen much easier.
Agree.
And
Definitely.
I told my children they can do anything what they want, just to be that what they choose, be also their hobby, because then they can be happy. So that's...
Yeah, I think that's extremely true. But I think burnout is real. I think for the whole medical profession, burnout is real. So I don't want to undermine that. And I think we all have to find ways not to burn out. And I think that somehow becomes a personal responsibility, because in every hospital, I think all around the world, administrators want the physicians to work more, harder, longer hours. And I think it is a personal responsibility for all of us to protect ourselves so we can continue our careers long term.
Professor Shah, we know you are a medical director of diversity and equity. Could you maybe tell us something about this role? What does it mean? What can we imagine around?
It means a lot of things. So if you think about diversity, the most obvious diversity is race, religion. But then if you really think of diversity in the broader sense, it is not just race and religion and ethnicity. It is diversity of thought, diversity of lifestyle, socioeconomic, sexual preferences, gender. It is so many things. And I think medicine is a field where every day we encounter diversity in our patients, in our colleagues. And so I think this is a way to formalize the importance of diversity. As far as equity is concerned, you can think about equity in terms of leadership roles, in terms of salaries. And for me, one of my pushes has been to ensure that women in medicine have equity in leadership roles as well as in salary. And while leadership is transparent, salary is opaque. No one knows what the other person makes, right? So I have encouraged women to speak freely about their salaries and advocate for themselves, and then use their male colleagues as allies to also advocate for them. And so this is something I take pretty seriously, that we embrace diversity, but we advocate for equity. And then the I is for inclusiveness. So, a very simple example is equity may be like inviting everyone to a party, but inclusiveness is asking everyone to dance with you, right? So it's no point like you just check off the box and you employ sort of certain people to make it all equitable. But if you don't make them feel part of your team, then I don't think we achieve our mission. So I think for all of us to be good citizens, respect each other, our patients, because our patients also come from diverse backgrounds. I think whether it's a leadership role or just actively thinking about these issues is important in medicine.
I think it would be nice to have such a nice position and role, and very important role as well in Slovakia. What do you think?
Yes, for sure.
I
think we are not talking enough about this problem. Many people just close their eyes and try not to see this, but reality is that women has lower salaries than men for the same work. That is for sure. And also, I have some experience with that, so I think it's real, this problem, and we should talk about it, and we should do something.
So what I did for pediatric electrophysiology is in 2019, I was the president of the Pediatric and Congenital Electrophysiology Society, and we created a survey with active participation of men and women, and we collected data for years you've practiced medicine, your leadership role, your academic affiliations, but also your salary. And it was great to see that I thought people would not include their salaries, but they did. And we were able to show that for every dollar a male physician made, females made 78 cents on the dollar. And we were able to publish this work. And we were the first subspecialty in cardiology to make this public in the form of a publication in a journal. And subsequent to that, other subspecialists in critical care, interventional cardiology are also using the same database to investigate their own subspecialties. And I hope this will make a difference.
Which book, application, or tool would you recommend for aspiring young pediatric cardiologist or electrophysiologist?
That's a tough one. So we'll start with pediatric cardiology, and the Bible, if you will, of pediatric cardiology is the original Moss and Adams book of pediatric cardiology. It's, I think, at least 2 volumes now, so it's a pretty big bulk of reading, but I think that is the textbook that I would go to. And in pediatric electrophysiology, a lot of what we learn is from adult electrophysiology. So my personal preference is to read adult electrophysiology books because we can learn a lot from those books.
Mm-hmm.
Maybe I would just add Ed Walsh, his book in electrophysiology I don't know the exact name now, in congenital heart diseases, because it's also a good book. But generally, I would say that it depends. I am not sure if I have really certain books or certain apps or something to motivate for cardiology. It how the medical students go through the fields. I think they feel what is close to them, and they don't have to have some book. But many times there are people who they meet on this way through this studying what decides, or maybe their relation to somebody really wants to do something with eye, somebody. So I was also thinking between psychiatry, neurology, and cardiology. So also was not decided directly. Yeah. But what is important, I think, when somebody is going to medical school and then when he's going to work as a doctor, it's that he should be really convinced that he wants to do medicine as a mission, not as a work or a job, as a mission. Don't think about this exact strict dividing, this is my work, this is my life, because it should be something together, and to be prepared to be very flexible, because sometimes it's very difficult. You go to vacation and patients call you, and if it is too much and too often, I was also sometimes nervous that, oh no, I don't want this. But you have to accept it and you have to do it. And that is very important for medical students to realize that this is their life in the future if they want really to be doctors. The topic of work-life balance, my questions, I'm curious, do you meet the new generation of doctors? They strictly expect the work-life balance from the occupation, or isn't it so? And maybe it's like,
I think there's a trend to put a lot of emphasis on work hours. And again, don't get me wrong. I mean, I think we have to protect ourselves. But as Vieru said, we have to be flexible. You can't put like hard times for your work hours. And I think one great part of pediatric cardiology is that it's a team approach to medicine. So an individual may not have to take that much of a burden on him or herself. I think having good relationships with your colleagues helps you out. So maybe if you're on vacation, I mean, Vieru is the only pediatric electrophysiologist in Slovakia, so I know she cannot do that. So she needs to get help. But I think having colleagues to help you out and reduce some of that burden on an individual helps. But I do feel that there's a huge emphasis on work-life balance before work.
Professor Shah was talking about this theme. I think this is very important in medicine, to have the ability to work in team and to suppress ego, because ego is very sometimes, or everybody has ego, but in medicine sometimes it's bigger even than in other professions. It's my sometimes opinion. And so to work in team and to little bit suppress your ego and to every time to put bigger importance to a patient than to your ego. Because sometimes if ego is winning, not patient, then it's not good. So this is very important. And I think there is not enough education during medical school and also among doctors about these problems, how to work with yourself to get these abilities, or I don't know how to say it.
Maybe I have the very last question. What is the goal of your stay in Bratislava, and how did this idea come about?
So my goal here is collaboration. I certainly come from a very high volume center. So I have certain expertises just because of the volume of patients I treat. But I'm very interested in learning from Dr. Illíková. She's the only pediatric electrophysiologist in your whole country. And I am learning from her work practices and her collaborations with her adult colleagues, and really just learning a different way to practice medicine in a smaller country where perhaps the resources are not so freely available as they are in the US. And also learning some techniques from her and her colleagues. So I really think, for me, this is a collaborative mission where I hope I'm contributing something to their practice, but I'm also learning quite a bit. And I want to sign off by saying that Slovakia is a beautiful country, and I've just met the most wonderful people here, and I'm very grateful for the opportunity to be here.
Thank you. Lovely.
Thank you very much for this. It's very nice from you. And I must say that I am very happy that you are here. We are also learning. I'm also learning because it's all the time that something you can teach, but you can learn. But I learn a lot. We did some procedures together, and we can ask anything we want. And Professor Shah is very clever and it's like unbelievable for me that she knows
very
everything.
Kind of you.
She
very
knows
kind
everything.
of you.
And it's very, very nice to cooperate. And the basis, maybe I would say something about history, because it started in 19 years after revolution, that the United States for International Development decided to support some centers in Europe, in Eastern Europe, and through Project Hope, they gave not only technology and money to some centers in various countries, like in Hungary, in Poland, in Romania, Bulgaria, and here in Slovakia, but also they started to exchange program that we had few times. Whole group of doctors and nurses from Cardiac Center in Boston came here, and we worked with them. And at the time, we, for example, didn't know anything about single ventricle. So we were doing it not a good way. So we learned a lot from them. And then, everything is dependent on people, and the Dr. Gil Vernovsky that time was the leader of that, and he went from Boston to Philadelphia, and so we continued. The Project Hope finished, but we continued the cooperation with Philadelphia, because Dr. Gil Vernovsky was in Philadelphia. And so few of us were there, people from there were here, and then we continued also after he left Philadelphia. We still continue to make cooperation with the hospital, and we started in 2013 video teleconferencing. So we discuss, we consult our very complex patients through video teleconference with doctors in Children's Hospital of Philadelphia. So it's fantastic, because when we can send them, and they can see, and we can see all these diagnostic modalities, echo, CT, MRI, everything, and we can discuss about it, what they would do. So this is the fruit of that, because I was in Philadelphia a year ago for 1 week, and then just we made this visit for 2 weeks, and now I'm saying that at least month would be nice. But
I told her I would lose my job and she would have to hire me here.
Perfect. Thank you for coming. We really appreciate that you joined us, and please enjoy the rest of your stay in Slovakia.
Thank you so much.
Thank you very much. It was a pleasure to be here.
Okrem našich pravidelných stretnutí pri podcaste Kardio MD pre vás tvorím aj odborný kardiologický newsletter s rovnakým názvom. Je určený pre všetkých súčasných aj budúcich kardiologov, internistov a všeobecných lekárov, ktorí majú chuť rásť, inšpirovať sa a zdieľať svoje tipy v komentároch. Každé 2 týždne vám vyberám zaujímavé štúdie, kongresy, aplikácie, rozhovory a klinické tipy z kardiológie, ktoré zaujali mňa na mojej kardioceste. Nezabudnite sa prihlásiť na odber prostredníctvom linku v popise. Ďakujem, že ste s nami.